All right, this is episode 16 of Ask the Doc. I got an email this week from a potential patient. They had labrum surgery about 4 years ago for a shoulder problem, and they were just honest and very transparent and said, you know what, my shoulder's actually been worse since I've had the labrum surgery. They're 46 years old and they're pretty active and do CrossFit and a lot of training. And they wondered why, hey, I got this surgery. You think when we get surgery that you're just, it's going to fix the things. But the problem with the labrum is like a cartilage, like a cushion in the shoulder. And basically the shoulder just kind of wants to sit in there nice and free. What goes on over the years is you put a lot of force in there and that shoulder starts to jam up on itself, and then it starts to degenerate the labrum. But the labrum doesn't degenerate on its own. It usually comes from other things not working correctly, and usually that's muscles in the rotator cuff. They get a lot of that adhesion that I always talk about. So they go in, the orthopedic doctor goes in and fixes the labrum, but the problem is the labrum doesn't get good blood flow, doesn't get good oxygen, so it really doesn't heal well. So while it might have fixed that problem, the other problem is the rotator cuff isn't functioning how it should, so it continues to cause that problem. So a lot of people get these surgeries and they're just not any better. The problem is because no one got down to the root cause of what's really causing it. So in my office, we're not going to fix the labrum, but what we're going to do is fix all the surrounding tissue to give that a chance to heal up a little bit and not make it any worse. But a lot of people don't understand that, and they just think, hey, the surgeon did the work, it should be good. But that isn't the case at all. So that's our Ask the Doc for this week. Send your questions in and we'll try our best to answer, and we'll see you guys next week.